All right, let's dive right in. Today, we are tackling a really important question in critical care. When a patient is in the ICU, literally fighting for their life, could something as simple as adding fiber to their tube feed actually help save them? We're going to break down a brand new, major review that puts this exact question under the microscope.
It seems like it should be easy, right? A patient needs food, so you give them food. But in the ICU, the simple act of feeding someone is incredibly tricky. It's really a high wire act, where one wrong move can set off a whole cascade of serious problems.
And get this is the scale of the challenge we're talking about. Up to 3/4, that's 75%, of all critically ill patients suffer from what's called feeding intolerance. Their bodies are just under so much stress that they struggle to handle the nutrition they so desperately need. And this can spiral into really nasty complications like diarrhea or constipation, just making an awful situation even worse. And all of this brings us to the heart of our story today, the ICU feeding dilemma. In this kind of high-stakes environment, nutrition isn't just food, it's medicine. But actually delivering that medicine in a way that helps, without causing more harm, is one of the biggest challenges that intensive care teams face every single day. So, the go-to method is something called enteral nutrition. It's basically tube feeding that goes right into the gut. And for years, the theory has been that adding dietary fiber to these formulas could be a total game changer. The idea was that it might support the gut and just make this whole process a lot easier for the patient to handle. But here is where things get really muddy. The experts just can't seem to agree. You've got the American guidelines on one side, and they cautiously say, yeah, maybe use some soluble fiber for stable patients. But then the European guidelines look at these same data and basically say, nope, we're not convinced, and they make no recommendation at all. So you have a clear split in opinion. So what doctors need, is some clarity. And that's exactly what this research set out to do. The authors wanted to try and settle this debate by gathering every single relevant study ever done, putting them all together, and analyzing them with some really powerful tools, including one that basically acts like a scientific fact-checker. And what they found? Well, at first, it looked incredibly promising. When they pulled all the data together, the results seemed like a clear, powerful win for using fiber. The first big headline was just staggering. They looked at 12 different studies with over 800 patients, and they found that those who got the fiber supplemented nutrition had a 34% lower relative risk of dying. I mean, that's a massive potential benefit. And the good news didn't stop there. The analysis also showed that these patients, on average, got out of the intensive care unit 3.5 days sooner. For any family with a loved one in the ICU, you know that is a huge, huge deal. And the benefits just seem to keep on coming. When they looked at the total time spent in the hospital, the effect was even bigger. Patients who got fiber were leaving the hospital a full week earlier on average. So the case for fiber was looking stronger and stronger. On top of all that, it wasn't just about survival or hospital stay. The fiber was also linked to a big drop in both diarrhea and constipation. The exact feeding problems that we started with. It really looked like a home run. But as you know, in science, if something looks a little too good to be true, you have to dig deeper. And this is where our story takes a really critical turn. The researchers didn't just stop at the good news. They performed what I'd call a scientific reality check. And this is the kind of question that separates good science from great science. You have all these promising signals, these exciting clues that point towards a real benefit. But are they solid? Or could they just be a statistical illusion? So here's the central conflict laid bare. On one side, you have these incredible, promising results. But on the other, you have a really serious problem with the quality of the evidence that led to them. The issue was that the whole argument was built on a pretty shaky foundation. The 20 trials they looked at were mostly tiny, with an average of just 56 patients. Almost all of them were done at just a single hospital. And this is the real kicker. Not one single study was rated as having a low risk of bias. The entire foundation was just weak. So to really stress test this weak evidence, the researchers used a special tool called trial sequential analysis, or TSA. Now, the best way to think about TSA is like a statistical lie detector. It's designed to stop us from getting overly excited about a result that might just be a coincidence, a random blip that looks real only because the studies are too small. It asks, do we really have enough proof to be sure about this? And the verdict from that lie detector? Well, it was clear and it was sobering. For every single one of those exciting findings, the lower mortality, the shorter ICU stay, less diarrhea, the TSA concluded that we just don't have enough information yet. The results were so wobbly that they could very well be a false alarm.
So what does this all mean for doctors and patients in the ICU today? This final part gives us the verdict based on this really deep, careful analysis, and it shows us the path for what has to happen next.
The researchers used a system called GRADE to basically give a final report card on the evidence, and the conclusion was pretty unavoidable. The certainty of evidence for reducing mortality, diarrhea, or length of stay was graded as very low. And that's because of that high risk of bias baked into all those small studies, and the simple fact that the results were just too imprecise to be trusted.
So what's the bottom line for the clinic? Despite those really promising initial numbers, the final takeaway from this exhaustive analysis is this: we just can't recommend the routine use of fiber for critically ill patients. The evidence simply is not strong enough to change medical practice, at least not yet. So where do we go from here? Well, the path forward is crystal clear. We need better science. Specifically, we need big, well-designed, high-quality trials that are run across many different hospitals. That's the only way we're going to get a definitive answer and really figure out if fiber works, which patients it helps, and which kind of fiber is best. And this leaves us with a final thought. We've seen the incredible promise, but we have also come to understand the deep uncertainty. And this is a perfect example of the scientific process working exactly as it should. It's tough, it's self-correcting, and it's always pushing for the truth. The question that remains is, when we finally get those big, definitive studies, what will the final chapter of this fiber story actually be?